We know right now it's hard to tell for these chronic conditions, and it's hard to effectively prevent or treat. Nevertheless, we have such a high life expectancy, so it's not so bad. But what about, could we push it even further? Maybe, of course, a lot of people would want to live more years, but start with quality. Why? Quality of life is hard to measure because it's highly subjective. We developed some methods. There's some factors that should be in a good condition for good quality. For example, biological health. That means the absence of any severe diseases or symptoms. Pain, for example, is also highly subjective. If the patient says they have pain, how can we prove that? How can we even measure how severe the pain is? So these are a lot of challenges. So there's the biological, the psychological, and the social health. All of them contribute towards overall quality of life. And yes, we want a high quality of life. It's hard to conduct reliable studies on how well the overall quality is in society, but if we consider these three factors, for example, we can break it down towards a more measurable approach. Let's take an example. For the age group of 50 to 60 year old, in this overall society, there's for example 90% who don't have any biological disease or subjective symptoms, and we could try to measure the psychological and social health as well, and plot these numbers and then compare different countries or societies or locations and so on. The goal is of course to maximize quality of life years, and if we want to go towards that goal of increasing the quality of life, how can we achieve that? I mean, controlling biological factors has been solved pretty well with the already discussed options like surgeries. Antibiotics contributed a lot towards increasing quality life years. We are so developed that we could leverage all possible resources to optimize quality life years. And how would TCM or traditional Chinese medicine play into that? They gathered some knowledge over thousands of years, and biologically, acute conditions are solved or evolve even more, but we're already very good at this with the evidence-based medicine. TCM would have to fill the gap in chronic conditions, prevention. I mean, if there's already a widespread tumor with metastasis, unfortunately, in the body, TCM won't solve that either most of the time, unfortunately. So we have to live with that. There are new drugs being developed frequently, and they seem to be increasing life expectancy even in that condition, but the ideal case would be to either prevent this at all, but that's very hard to do, or at least to slow it down, like over the long term. Like, let's consider like lung cancer, one of the most frequent cancers. Maybe there's already one cell, like one tumor cell in the body, but it evolves, like, until it becomes a problem or until we realize it's there, it might be 20 years passing by, which is kind of lucky for that person, right? So they have 20 years without worries, and yeah, unfortunately, suddenly they get this diagnosis. And it's very hard to gather evidence on prevention, but there might be an edge on prevention, actually, or on like delaying the disease progress over the long run, that TCM might be beneficial for. How? Well, that's very hard to tell, but it's very interesting to explore. So let's dive more into that next time. Hello, good evening. Today I want to talk about traditional Chinese medicine, or TCM. I've been studying this for a few years now. I've also studied the traditional Western medicine, or MD, and I really like both approaches to health. I'm very passionate about health, so let's dive into some of the experiences that I made in this journey. I'm excited, and it's very interesting because fundamentally both want to promote health, right? So it can't be that wrong intention in general, and I see them mostly as complementary other than opposing systems. So there is different approaches, and of course it evolved in different directions a little bit. Like, let's dive into some of the history. Like in Western medicine, we had the rough surgical approach in the Middle Ages, and then the evidence-based or pharmacological medicine emerged. This is the era we're in now, right now. So every new treatment needs to be approved, and that means it needs to undergo meticulous statistical testing and to prove if it's effective. And most of the new drugs or a lot of the new treatments, either intervention like surgery or medications, are rejected because they did not show efficiency compared to the current standard. So yes, this is not easy to like fake, right? The treatment has to be effective in order to be approved, which is a good development compared to like just randomly amputating organs or extremities in order to cure people, when even if there's no actual base for the improved quality of life or life expectancy after the treatment. So I like the developments of the 1950s of that system, and let's look at the history of traditional Chinese medicine, at least how we can perceive it in retrospect. It's a very long process. It took a couple of thousand years to evolve, but the basic principles are quite interesting. So one of them is, for example, do whatever helps. So the patient is somewhat empowered and knows what's best for them. So whatever works, whatever increases well-being is helping, right? It's promoting health. And it's a very minimalist approach most of the time. This evolved through the concept of barefoot doctors, which are like, they received some training in TCM and then went to the villages in different Chinese prefectures and like promoted. So the village has someone to go to if there's a like disease or symptoms, or they can go to the barefoot doctor. The barefoot doctor does some treatment that is available and might be helping, and at least there's someone listening to the problem of the people and trying to help, right? I mean, this itself is helping more than like not having anyone to go to if there are symptoms or disease. So yes, that of course can promote health, well-being. If there's someone, doesn't need to be like highly sophisticated, educated, just someone there to where you can go to in person physically. So probably this is one of the approaches of both systems. It's like someone listening, having some concept of like understanding the disease process, having probably seen it before, knowing what worked before, and applying or suggesting that treatment option to the patient. Okay, so but you might ask, what's the point of doing like these traditional methods? There are two paths in TCM, which is acupuncture and herbs, or like the pharmacy of back then. And there have been some studies conducted. I mean, it's not that easy to really conduct studies on significance level to gather that much data and thousands of patients to prove like a small effect that acupuncture might have, because this is like a very expensive process to gather so much data, to have it in a controlled, randomized environment. So yes, you need a like big level outcome in order to make that investment into research. But there have been some studies, and it seemed to alleviate some symptoms in some cases, and there's might be also some scientific base, for example targeting the vagus nerve. Either it's like in the foot or in the ear, acupuncturing, or generally along the spine, might have some relaxing effects. And also they did some MRIs in the brain and showed some effect. Probably like this system didn't really evolve on a like science base as we know it today. Like doing these randomized trials, 2-arm or 3-arm, and like actually proving on a significant statistical level. I mean, they did know statistics for a few thousand years in in China, there is a very famous book about statistics. So there might be some of that also going into that like health approach, but in general, like they didn't use the same terminology, like p-values or something. So it's hard to like view it from a standpoint where we are right now with evidence-based. But if it's like so old and gathers so much knowledge, like there's hundreds of books on health from the past 5,000 years or something in Chinese. Like having so much data is also hard to ignore, right? Like if it didn't work at all, why would they still do it for like just abandon it after 100 years, right? Why keep it for 5,000 years or let's say 2,000 years? So the evidence comes from like the treatment or the approaches that made it till now might have some made it till now might have some benefit, because why otherwise would they keep the approach for that long? So like this is like the only evidence we might be able to take from that. But and also there might be the question why, like they had to deal with different kind of problems back then than like 1,000 years ago, for example, than we are dealing with now in the like developed nations or developed economy. Like back then probably malnourishment was a bigger problem in the country than it is now. Like overnourishment is more of a problem right now, like too many carbs or stressful lifestyle, high cortisol and stuff like that. So can we still take some of the evidence they gathered throughout this malnourishment period for our overnourishment period we're in right now, like set like on average? Hard to tell. Yes, I agree. It's might like some of the information or some of the approaches might not work for the problems that the average society is facing right now health-wise, and also like different climate conditions, like living in for example in the border towards Kazakhstan or in the mountains of China has probably some other like environmental factors posing on the humans than living in Spain on the coast. So yes, maybe it's not on general, not everything is transferable to every location and like the time right now, but ignoring like that much knowledge at all, I don't know if it would increase like overall health. Like that's the goal, right? Healing you either yourself or in general the society moves towards a higher level of health and life expectancy, and especially quality of life, like quality adjusted life years. More of that is always better, and we would want to move towards that goal, because that helps in every aspect the overall economy. If people live longer, they can buy more things, consume more, also contribute more, work longer years, more years in good health, have more quality of life, and spend more time with their loved ones, and so on. So we would opt for higher amount of quality adjusted life years overall. And we have a lot of effective options from evidence-based medicine. For example, accidents. If someone unfortunately suffers from a car accident, of course they need surgery to get their leg repaired and screwed back together or something like that. And that's where we of course need antibiotics, surgical methods, trauma surgery, and all kinds of orthopedic approaches, imaging related to that, OR with a lot of medications involved, narcotics, anesthetics, and so on. So yes, of course we need that. And for acute especially, I think there's no better approach than what we already have, or maybe we can develop it even further. So the surgery will be slightly improve the quality of life even more with some new methods or more minimally invasive. So yes, I'm so happy that we have this approach for the acute cases, especially accidents, infections, antibiotics. This is a game changer, since we have penicillin since late 1800s, early 1900s. Life expectancy has skyrocketed, also due to some birth improvements of maternal and infant survival approaches. So yes, we can be so proud of this. The average life expectancy in developed nations is around 80 years, depending on the specific country. Japan is always the leader, and Europe is in between. So yes, we can be so proud that we have these systems, and they are working, they are sustainable. And for the chronic cases, this is the leading cause of most age-related disabilities, and diabetes, heart disease, and cancer. These are the big three things that will hit many people above their 70s, 80s. But this is not an acute condition in most cases. Diabetic doesn't evolve overnight, and cancers, sometimes they're very fast growing ones, as also in young people, but this is very rare, maybe 10 in 100,000 cases. Most of the time it evolves slowly. Heart disease can evolve over decades, and we have some acute treatments that of course also increase life expectancy. That's the good thing about evidence-based. We know on average it works. It does add some years, or at least some quality to the years. So yes, but these big three are mostly slowly evolving, sometimes genetic, sometimes lifestyle related. It's really hard to find out what specifically causes the chronic condition in individuals, because it's develops over such a long time, involves so many factors. It's really hard to conduct studies that run over decades and then randomize or control the conditions. So you have individuals exposed to the risk factors and not exposed, and the rest of the conditions should be exactly the same, so you can compare the outcomes. In both cases, this is very hard to do in practice. We are approaching an age where we gather so much data on probably every person on the planet who owns a smartphone or with internet access. We can technically gather a lot of data about health-related data, like how much the person is moving, how many steps per day on average, how much workout, in what environment are they living, and so on. All these factors, like environmental factors. Technically, we're gathering so much data about billions of people, so maybe we can conduct